discussed. This disclaimer complies with California Business and Professions Code 651 regarding healthcare advertising.
Well, good evening, everyone. This is Leonard Thompson. I'm here with none other than Dr. Afflalo in her show that we love, Ask Dr. Afflalo. Here, Dr. Afflalo, it's been a little while that we've been here together, but we're back here and so many good things are happening. So let's just jump right on into it, and let's just start off by what's been going on in the world of IWC healthcare and also the practice and in the work of the community.
Well, thank you. Good afternoon, everyone. So, yes, IWC Primary Care, we have been busy over there enrolling new members into our practice. We've actually had, because we've grown so much, we've actually had to hire 2 new nurse practitioners to join the team, along with other medical assistants. So we are growing leaps and bounds to the point where I believe we have outgrown our space, and we've only been there 2 years.
Oh, wow.
So that's
Wow.
a good thing, a good problem to have, but now we need to either expand or find a new location. So that's just something on the works for us.
So will it be in the same area, or do you think you'll be moving to a different part of the city and what I say, our neck of the woods?
Yeah, the goal is to stay in Spring Valley because the primary care is needed there. I think there's only one other primary care office in the vicinity, and there's a lot of community there. So the goal is to stay there. There are some spaces in that building that we could maybe have 2 separate offices. So, this is just all in our head right now because we just barely got this one settled in, and within 2 years we've already, outgrown the space. But preferably, I would, prefer to be in the same building in the hopes that we could maybe get another suite in there.
Wonderful,
Yeah.
wonderful. So, as we have been navigating the world that we now call America, what are some of the things that are really impacting us as a community before we go on to our topic of today?
Sure. I think it's just overall just the fear of the unknown. As we move about in our daily lives, we are concerned about our neighbors and anyone that is affected by some of these new rules and things that are taking place, including our brothers and sisters that are being deported unnecessarily and rounding them up. We're concerned because just as we have our health fair once a month at Jackie Robinson, we were concerned about ICE coming to us last month. And with some concerns that we had to increase, like I'll say security at the front gate. But just across the street, less than 1/10 of a mile is this Home Depot, and it was just barren because they had already gone over there and raided the place and also frightened anybody that's been over there. And we've heard that there's other spaces where they were gone and raided places like small food distribution sites. So we just have to be on the alert, have our head on the swivel, watching out for ourselves and our fellow brothers and sisters that are, paranoid to go to work, to go to anywhere, go to the store. So, I think that's the biggest concern right now in everyone's lives. Whether it's impacting us directly, we are all being affected by it.
Well, do you think that they will start raiding clinics and hospitals and things of that nature as people are coming in to get service?
Well, I know it's happened. I believe it was in L.A. or somewhere that they actually followed someone into a clinic and was harassing him in there. And so I don't put it past anyone. There obviously is no rules at this point. They're just making up the rules and doing things that are about as illegal as you can get, and no one's there to stop them at this point. So we just have to be careful and do our best to, stand up for people that are being targeted for deportation to concentration camps, because that's what it is.
Yeah, and it's almost like it's designed to be a tremendous moneymaker, and we're not hearing anything about health care or anything that will make sure that people can stay healthy with COVID outbreak and all the things that are taking place. It seems like it's going to be a breeding ground or a death trap.
Yeah.
Yeah.
No, it's true. It's very concerning, but God's still on the throne, so we just need to continue praying and do our part. But just try to protect our neighbors as much as we can.
Amen. Amen. Well, let's talk about the topic of the day.
Okay, so our topic today is skin.
Skin.
Skin is the largest organ of our body.
Lord Jesus, now I was just trying to get my skin care and drink more water, and now you're gonna tell me that the skin is an organ?
Yeah,
Well, how is that?
living,
Organs is like
breathing.
organs like the heart, the liver, the kidneys. Well, how did the skin become an organ?
Well, guess what? If you have a certain portion of your skin that's not functioning, like burned, you
Hmm.
can actually die. It's a
Okay.
barrier to protect you from infection and things like that. So it is one of the organs that we need to care for. And and so with that, I mean, we do want to make sure we do well by it, keep it clean, keep it hydrated. And but there's things that happen to us, and two particular types of skin conditions that are fairly common, and I want to touch on, and then I just want to touch a little bit on the common cancer, skin cancer, because skin cancer is actually the number one cancer in the USA. We don't hear about it a lot, but because it's so often diagnosed, it is the number one cancer in front of lung and breast and prostate and all of that. So I'll just start off by mentioning eczema, and I'm sure a lot of people either have had it or know of someone who's had it or still suffers with it right now.
Okay, now
Am
hold
I
on,
getting personal?
because you started talking about skin cancer.
Yeah, but I just
And
mentioned that as the subject I'm going to go
okay,
to afterwards.
okay, because you start off right with eczema. And black folks we get some eczema, and sometimes can you get eczema later in life too?
You can, but it tends to start off, under the age of 5. That's the common time. But it doesn't mean you can't develop it at any point, including psoriasis, which I'll get to. So yes, eczema is a skin condition that causes dryness, itching, and inflamed skin, right? Tends to be, especially for babies, it tends to be on their face, their neck, their scalp. But the common places for teens and adults is usually in the folds, so the elbow folds and behind the knees. So anywhere there's a fold, those are the most common places. But it can happen anywhere. So the more you scratch, the more you itch. Which means that you get into that itch scratch cycle, and it makes it very hard. So as you start scratching that itch, you start, especially for people of color, you start creating more inflammation on the skin, which means your skin starts getting darker. So you'll find people with eczema, very thick skin, what we call lichenified, almost like leathery type skin, over the years of scratching and rubbing it. So the best thing to do is, if you have eczema, try to keep your skin hydrated, clean and hydrated. But there are going to be times of things that will trigger it and cause you to have inflammation. Usually we'll have the smallest amount of strength in terms of strength for a steroid cream that helps to settle down the rash and the itch. Heat makes the itch worse. So you don't want to take a hot shower. You want to take a cool, tepid shower or take a nice, cool washcloth and put it in the folds or wherever you're having your rash to settle down the itch. If it itches, you're going to scratch it, and then you just can't get out of that cycle. So most people that have eczema will end up having the other three, call them the 3 A's. So eczema is also called atopic dermatitis. Then you can also get asthma and allergies. So a lot of people have all three of those together. They tend to travel together. You're just an allergic type of person. But eczema it can be controlled, but it's a chronic condition, which means it'll wax and wane. You'll have flare-ups, and then it'll settle down and be fine for a while. Something will flare it up again. You'll have to take care of it in terms of trying to take a Benadryl or some kind of an allergy medicine to stop the itching. Use your creams, hydrate it, meaning keep moisturizer or something on it to help keep that itch and that rash down.
So let me ask the question. So I've been seeing all these social media where people are putting their face into a cold ice bath. Will a cold ice bath help with your eczema?
I wouldn't necessarily recommend that. You don't have to, your whole body doesn't, or your face doesn't have to be immersed in ice. You just need to put a cool compress to the area where you're having the rash, right? Because when you have eczema, your whole body doesn't itch, it's the area where you have your patch of rash. I don't know why they do that, because that's just a shock thing, shock you, but I can't imagine doing that. I know that athletes go into a ice bath to kind of, get their muscles and tissues back in functioning order, but I can't do that.
And they even have machines where you can walk in and you walk in at one temperature and they'll take it all the way down to like 20, 30 degrees. So it's not an ice bath, but it has the same effect. And my thing is, how does that affect the skin? Because you talk about the skin as an organ and a protector, and it just seems like the people that live in the wintry areas got thicker skin than us people that live in the nice climate such as San Diego.
Well, the nice climate in San Diego, we also means they have the sun, which is another whole thing on your skin.
Okay.
I would just say that, I mean, most people are going to hydrate. So in the winter, you're going to be covered and protected. So you're not going to be, you won't be exposed to the elements, the frostbite and things like that, or the freezing temperatures. You should cover up well. But the hotter weathers, we tend to be more exposed. Our skin is exposed. We don't always wear sunscreen, including people of color. We should wear some sunscreen.
Hold on. We were made with the darker the berry, the sweeter the juice, and we got a lot of melanin. So, can black people get sunburned?
Yeah,
Okay,
yeah. You stay out in the sun long enough unprotected, you can.
okay,
So, and you can have areas where you'll be, and it's going to be the areas that are standing out, the ears, the nose, the shoulders, things like that. You should wear some sunscreen. You're more protected than someone without any melanin for sure. But you can't just make the assumption that you're completely protected.
Okay.
So you should wear sunscreen. If you're out there playing a sport and you're out there for a few hours, you should put at least a SPF 30 on or higher. If you're in the water with the reflection and stuff, you should put some on, some waterproof sunscreen. So, yeah, so with the atopic dermatitis or eczema, as we call it, it is chronic. So it doesn't go away, but it can stay dormant for a long time where you think it's okay, and then all of a sudden stress can bring it on, some kind of allergy to something can bring it on, and then you go again, you have to go ahead and take care of it, kind of get it under control. We've had patients where their asthma is so severe all over their body that we actually have to give them steroids to settle down the inflammation, right? So it can be very serious. Some people it's well controlled. Some people have it so diffuse or all over the body, and they scratch so much that they leave a lot of marks on their face and their body. So you can see patches of really dark, thick skin. That's just from the chronic itching and scratching for over the years.
Now, if you stop itching and if you stop scratching, can the skin thin out again?
Less likely. Yeah.
Okay.
I mean, you don't want to keep it. Once it gets leathery, it's pretty hard to get it back to smooth skin. So you really want to prevent that from happening. If you get a small patch that's darkened over years, because, we mark, over years it can fade a little bit. Just like if you take a burn, it takes forever for that burn mark to get off of our skin. So when we mark our skin like that, it's really hard to get it back to where it was normally. So the goal is to prevent that from happening.
So I got questions because we're talking about tough, leathery skin and skin as an organ. If you have, say, for instance, rough feet or your hands are really rough, are there any ways to soften those feet and hands up?
Yeah. So if you soak your feet and then use like a pumice stone or a file to get some of that thickened skin off, you can get down to something that's normal, but then you also have to moisturize it. So the best moisturizer, which doesn't sound like a lot of fun, is to put Vaseline on and then put something over it. So like at night, we tell women to, if they don't like their rough heels and things like that, to buff it down, put Vaseline on, put a sock on, and that moisturizes it. And then try your best not to be in like flip-flops or walking barefooted, because that's just going to harden the skin. And with sandals and things like that, the air is going to dry out your skin. So people don't have as much problem if they wear enclosed shoes. It's not as thick and not as dry and flaky. And when it gets thick and dry, it can crack. The skin can crack. You can have cracks in the heels, and then you open up for possible infections and pain.
Okay, so I'm gonna ask the question because back in the day, Vaseline was something that people use, but can Vaseline really moisturize? Because it seems like it don't leave your skin; it just sit on top of it.
No, it can. So the best moisturizers lotion just goes away. It evaporates, and you're dry in another 5 minutes. The best thing to do is either baby oil or Vaseline and put it on the moist skin and rub it in real good. It can moisturize the skin. You continue to do that. And there's things that Aquaphor, which has a little bit more, strength. A cream is going to be better than a lotion. But, you put on lotions, you might be dry and ashy hours later.
Okay.
So,
All right, let's go further.
okay. So, I think for eczema, you have to notice what or identify what are some of the triggers. So if you know that stress or allergies or irritants can flare up your eczema, you do need to try to avoid those things. Now, good luck avoiding the stress, but you need to figure out how to manage your stress and minimize it. And so you don't know what's going to flare it up. Sometimes people are allergic to animals, and then that might flare up their allergies and or their eczema. If they have asthma and their asthma flares up, it can flare up their eczema. Those three things tend to travel together. And then, of course, there's oral steroids and the topical steroid creams that we use to help with the control the itching and the inflammation. So that's kind of the best way to manage your eczema, is to just figure out what's possibly triggering it. Try to avoid that, and if you can't, then try to at least get on medications that's going to control the symptoms of itching, which is some kind of an antihistamine, maybe a Benadryl or a Zyrtec or something. Those things can help. And when you have severe cases, you definitely need to get to the dermatologist and see if there's anything else in their bag of tricks to help, because there's always something new on the market that it might be a little bit stronger to help take care of your symptoms.
All right. So we talked about eczema, and you said there's the asthma comes along with, many times the eczema comes with asthma and allergies.
Yeah, the three A's.
And so my question is, how do you really know that you have eczema, or could it be something else? Could it be a fungus or something else? How do you know the difference?
Well, your doctor should know the difference. So you may not know, but fungus doesn't tend to be dry and flaky, right? Eczema tends to be dry, scaly, flaky, and there's in patches. Fungus is not necessarily, it tends to be more in moist places, so you might get it in the folds of your skin, between your toes, things like that, groin, places like that where it's moist. And the fungus, skin on skin, the fungus likes that area, so you have to keep the area clean and dry. And you can put an antifungal powder on the area. That can get better. Antifungal creams and things like that. Eczema is completely different. And even though it can be in folds, it can just be on your face and scalp. So if you don't know, your doctor should know.
Okay. Can I ask a sidebar question?
Sure.
This new deodorant called Lumi, where it's like saying that you can use it all over your body to control the funk and everything else of that nature. And now everybody's coming out with full body deodorant. How does that affect the skin? Because we normally just put deodorant underneath our armpits, and I remember it used to be baby powder down in other spaces. How is that affecting our skin, our hygiene, and everything else?
Well, most of these ones that are like 72 hours, anti whatever, they're deodorants. They're not antiperspirants. So most people use a combination, something to stop the sweating and something to help stop the odor. So what they've come up with, and I think some of them do not have the, what's the word? It starts with a C. I have a blank on it. But some of it doesn't have the chemicals in there that some of the women are allergic to for underneath their armpit, especially if it puts them at risk for breast cancer. But keep in mind, you can have a deodorant which helps with odor, but you can sweat, and then sweat eventually can cause odor. So some people need both. Some people just need a deodorant. I don't think anyone puts it from head to toe. I think they put it in the areas that cause odor. Yeah. So folds, right? Okay. So groin folds, feet.
The funky areas.
The funky areas,
okay.
Yeah. So I don't think they're using it all over, even though they said it, and it is safe to use it all over. So I mean, that's the new thing.
Because when the commercials are crazy. She said you can put it in your butt crack. I'm like, oh my Jesus.
Well, not inside the fold.
Yeah. But it still seemed like it's still gonna smell because of what comes out.
Well, yeah. I mean, we're talking about once you wash and clean the area, you put that on, the odor, because just skin on skin with sweating can cause odor, right?
Exactly.
So what they're trying to do is prevent the odor from just normal daily activity. Keep that set of odors down. Okay. Yeah.
So I just want to get some highlights because I want to make sure that people are hearing it. So if you got rough hands and feet, at nighttime, slather up with some Vaseline.
Baby oil or Vaseline.
Yeah, with baby oil?
Baby oil or Vaseline.
Oh, Lord. All right.
I mean, they're both oily, so you have to put something on, like gloves at night or socks.
Now, are we talking about, like, absorbing, like What type of gloves? Are we talking about the latex gloves?
No, we're
Okay.
talking about more like the ladies used to wear in the church, or still wear in the church.
Wait, the
Not
usher
for y'all.
gloves?
Yeah, the
The
usher
usher
gloves.
gloves. All right.
Because you don't want the oil and the Vaseline on your sheets and things
Uh-huh.
like that. So you just need to put something in between, a layer between your skin and your clothing or your bedding.
Okay, now I'm gonna ask a question. So if I use it every night, because these are questions that I got. If I use it every night, the Vaseline is gonna get into the gloves. So do I have to slather up every night, or I just stick it into the glove?
No, you need to put some on each
Okay,
night.
okay.
Yeah, yeah.
All right. Well, see that's because we're talking skin, and a lot of people might say, well, how can I do this? And so you're saying baby oil. Sean P. did. Sean Coles. No wonder he had 1,000 bottles. But I'm saying, so you talk about either baby oil or Vaseline. Put some gloves on, and how long if my hands are really rough, how long would it take for my hands to kind of smoothen out?
It depends on what you do. If you use your hands in construction, then it kind of defeats the purpose, because as soon as you soften it a little bit, I mean, it only takes a few days to really moisten it up. But if you have thick skin, you need to get the skin down to something reasonable. But if you're out there with construction, moving bricks and that, it's going to always be on the rough side.
Okay.
Yeah.
All right. All right. Let's go to the rest of the skin. I got questions because I want to help people.
You want to help people. And then, so we'll go on to psoriasis.
Okay.
I'm not sure. It is still a common condition, but not everybody has it, like eczema. And when you see a patch of psoriatic rash, it tends to be a patch of red and silvery. It's almost have a silvery appearance to it. And it's a patch, and it can be red, can be silver on top of it, and it's scaly, dry, itchy, and miserable. And you can get it at any time in life, especially in the scalp and some of the folds and things like that. But you can tell the difference between eczema and psoriasis. At least your doctor should be able to.
Okay, but the psoriasis itch?
Yes.
Okay.
Yes, it can itch.
Because I think I had a touch of psoriasis, and I kept on putting moisturizer on it, and it didn't itch; it just stayed there. And then one day, I took a hot bath, and all of a sudden, it just came off, and I'm like sitting up there like, what was that about? Had been there for like
I don't know what that was.
yeah, okay,
But, I mean, it flares up and down just like eczema does. But it's definitely different. And psoriasis puts you at risk there's some people that have psoriatic arthritis. So you can actually develop arthritis of the joints along with having psoriasis of the skin.
wow.
Yeah.
Now, does the skin give it to it, or are they connected?
No, it's more of a autoimmune type of thing. So some people have the arthritis, and they call it psoriatic arthritis. So you'll have the combination of a skin condition along with the arthritis in certain joints. Some people just have arthritis, the skin condition. So it's not fun to have either one of them, but definitely both together can be annoying because you're having pain and you're having itching of patches. The patches you can see a mile away. They're just kind of silvery patch, thick and scaly. And it requires treatment on that too. Most of the time, it's going to be a steroid cream of some sort.
Okay.
Yeah.
All right. So eczema from birth.
You can get it early on in
Okay.
infancy, yes.
And then psoriasis could come at any time.
Anytime.
It hit you anytime.
Hit you anytime. And it tends to be, you have to be careful because there is a family history component. So if you have other people that's had psoriasis in the family, you're certainly more likely to get it than just any Joe Blow on the street.
Okay. Okay.
And they do say that smoking tobacco increases your chances of having psoriasis. That part I did not know, but
Okay.
yeah.
All right.
So, and then it does have some, let's see, greater risk of having the condition. So psoriatic arthritis, causes pain, stiffness, and swelling around the joints. And then if you obviously have psoriasis, once again, another patch of a scaly looking skin. If you scratch that, you can have darkening of your skin, especially for someone who already has dark skin. We just mark our skin. There's also what comes with, it sounds like psoriasis also can come or be associated with conjunctivitis, which is inflammation of the conjunctiva, which is on the eye, the covering of the eye. So you'll see like a pink eye, that's conjunctiva or conjunctivitis. Blepharitis is more like a inflammation along the glands on the eyelashes. So you'll see this flaky look like your eyelashes have dandruff, very annoying and itchy. That can be associated with too. Or uveitis, which is still in the eye. and you can have inflammation in the eye. So it sounds like there's a lot of eye conditions that can also come with psoriasis.
Wow. And so now I want y'all to pay attention because, I just saw like 5 people that I know that got conjunctivitis. And I don't know if they know they got conjunctivitis. We're going to have to tell them.
Or they could just be sleepy and tired and have red eyes.
Yes, yes, yes. But pink eye, when you get pink eye, it seems like you know it because it don't change. It gets more, it starts burning and everything else.
Yeah, well, pink eye conjunctivitis can be from various causes. Viral conjunctivitis, so if you get a cold, you can get a pink eye. Little different than the conjunctivitis from bacteria, where you'll have the crusting and the weeping, and it's contagious. Kids get it, and you rub your eye, and next thing you rub the other eye, and now both of them have it, or somebody touches, or you use a washcloth and you get it. That requires an antibiotic eye drop.
Yeah.
Right. So, but viral conjunctivitis comes and with your virus, and then it goes away on its own. You can use, what do you call those drops that treats your red eye or whatever? Visine and stuff like that, but it's not going to take care of the actual viral problem. That goes away on its own. But if you don't want your eyes red and people thinking that you're contagious, then you can use some of that just temporarily.
Okay.
Yeah.
Next topic
All
on the
right.
skin.
We're gonna actually move on to the 3 most common skin cancers.
Okay.
So skin cancer.
Can we start? Well, let me ask this question: are there more common skin cancers that Black people get, or are we just doing in general?
In general.
Okay.
Because skin cancer tends to be more prominent on people that have fair skin, blonde hair, freckles, so just really fair skin. And God forbid if they stay in the sun or they're in a tanning booth. Those 2 things are no-nos because that really puts you at risk for skin cancer.
See, all you dark-skinned folks, give praise to God, praise the Lord.
Absolutely, absolutely. So skin cancer tends to be where there's kind of a abnormal growth of cells on the skin, usually exposed to UV exposure, sun tanning booths, things like that, starts destroying it. So the most common, there's 3 most common. There are other types, but the most common ones are basal cell, squamous cell, and melanoma. And a lot of people hear about melanoma. That's the most dangerous one that you can lose your life behind. So basal cell is pretty common. It tends to be more focused, doesn't spread as easily as the other 2. But it can destroy something. So it tends to be more on the face. You can get it on your arms and things like that, but it'll kind of set up roots. So if you have like a pearly thing on the side of your nose, shiny pearly, looking like I wouldn't say a pimple because that tends to be white, just a mole, but it's the same color as your skin. That actually looks like it's just located there, but if you don't take care of it in a timely fashion, it can actually start growing roots and get deeper down into the area. So it won't spread across the face or something, but the deeper it gets or the longer you wait to treat it, you actually have to have reconstruction of the part of the face. So there's a procedure that sometimes you can just freeze off certain cancers, freeze it off with liquid nitrogen. Sometimes you can just shave it or do a biopsy, and that takes care of it right then and there. All you need to do is get some clear borders. So if the cancer is here, you just get a little bit more around the cancer. Once you have clear borders, you've got it. But if it's deep-seated and starting to grow some roots, then that's when you need a procedure called Mohs procedure, M-O-H-S. And they actually need to do a procedure where they actually go in deep and take an area around the nose, the ear, and they have to reconstruct the area because now you have a big void on your face if you wait too long. That's with basal cell.
Okay, so wait, now you got folks concerned because they trying to say, I had one right here and I just scratched it off and it's no longer here anymore. How do you know if it's basal cell? Because, sometimes we get a pimple and it just don't go away, or you might got a little bump right here. You just think that it's, how do you know when it's a cancer? Is it painful? Is it?
No, we usually kind of measure things by A, B, C, D, E. So if you've got something on your skin and you're not sure what it is, you just kind of follow along. You can certainly ask your doctor, if they know what it is, and if they don't know, they can send them to a dermatologist to get further evaluation. But what we usually do is A, B, C, D, E. A is for asymmetry. So if you've got something on your skin that's asymmetrical on the borders, it's not just smooth and like somebody just plopped it on there, that's of concern.
So you're saying when you gotta give us some layman terms. Are you saying it's bumpy? It's
No, it can actually even be flat or just slightly raised, but the borders need to be like you drew them evenly versus some irregularity. So
okay.
B is also borders. So asymmetrical. A is for asymmetry. So not symmetrical, not
Okay.
even on both sides. B is borders. So if your borders are irregular, that's of concern. C is the color. So if you start having multiple colors in this, if there's a pink and a red and a brown in that, that's concerning. Not just a regular one brown, like I got one brown here and it's flat. That's nothing. D is diameter. So if the lesion is bigger than a pencil eraser, you watch it. And E is the evolution of it. Is it growing? So was it small now and next week it's bigger and next week it's bigger? That's something that needs to be concerned. So you think about, the shape, the borders, the color, the diameter of it, and if it's starting to evolve and grow or spread, you need to be seen. So I don't see as many basal cell and squamous cell or even melanoma on black folks, or they just don't come in complaining about their moles, But white people have a lot of skin things, different moles, and we have to literally strip them down and do a mole check. They should have a full skin evaluation because their moles can start changing.
So what you're saying is that if you start getting moles around, on your eyelid, or you need to come in and get it checked out.
Well, you might be confusing moles and skin tags. Because moles don't usually come up on eyelids, but skin tags do, like those little things that you want to pick off or pull off. Yeah, that's a skin tag. That's completely different. And those are usually very benign or not cancerous.
So how do you? Because I see as African American people get older, I see more moles on their skin or more
Skin tags. We get a lot of black things.
Yeah. So how because I'm just gonna be honest, Dr. Scholes came out with this freeze away, but it don't seem to work as good as when you go in and that doctor say, "Oh, let me just clip that off," or that doctor get that little spray and it be knocked out.
Yeah.
So tell me, why do African Americans get so many skin tags, and should we come in every time, or because I heard in some places you got to make a surgical appointment.
It depends on skin tags are pretty benign. They're usually dark, and they tend to be raised, like you can hold them or whatever. They're just raised. Some of them look like a little broccoli stalk, on a stalk. They're skin tags that we have to hold and clip off, but those are fairly common and they're benign. They're not cancerous, and they're not going to be your basal cell, squamous cell, or melanoma. But if you have a mole, so a skin tag is going to be more of a raised thing. The moles tend to be more on the flatter side or slightly raised, but they're not a skin tag that dangles.
Okay.
And so we do get a lot of skin tags, black things on our faces. You'll see them around our necks and things like that. And they tend to run through families. I mean, my aunt was studied with them all over the place, right? Someone needs to look at them and make sure none of them look suspicious. And, we're not going to sit there and clip off 40 skin tags. You're just going to have to live with them. I wouldn't use the over-the-counter Dr. Scholl's whatever, because then you can burn your skin too. But we do freeze with liquid nitrogen, some of them.
So my question is, if I go to my local physician and I got 10, they ain't gonna take all 10 if I ask them to?
If you ask them nicely. I mean, because if you have 10 other problems, they don't have time to do that. But if you're coming in strictly for that, yeah, they should be able to do
They're not gonna send me to the cosmetic surgeon and say, you gonna get a consult and go and get it all done.
No, cosmetics, it is cosmetic, but you would have to pay out of pocket for that.
Okay.
So, and the dermatologist, if you refer to the dermatologist, they're going to reassure you that they're completely benign and send you home. So if you're nice to your primary care doctor and they feel comfortable doing them, snip, 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 or freeze a little here and there.
Yeah. I like those nurse practitioners because they ready to cut.
Oh, yeah. They'll take care of your skin conditions for sure. So basal cell, like I said, it is definitely going to be in the sun exposed areas. You're not going to find one like on the middle of your back or something like that. But they are common anywhere in the head, the face, the neck, the hands, the arms, and they're very slow growing. But you have to watch them to see if they're changing colors or just shapes or something like that. And so, but they do tend to be destructive locally. So like I said, they don't spread all over the place. But they can, if you let them stay too long, they can set roots up, and then you have to go deeper, which means now you've taken a whole bunch of stuff out of your face, and now you have to find cartilage and skin to replace and reconstruct your face wherever. Usually it's on the nose, the side of your nose, on the face, on the ear, something that's sticking out where the sun is. So if you're not protecting yourself with a wide brim hat or some sunscreen or something, you're certainly at risk. But it's more common with white folks, especially when they're laying out trying to get to be our color. Squamous cell is another type of cancer, not as aggressive, but it does grow more rapidly than the basal cell. And so there's a better chance of it spreading, but it's not as dangerous, and then you can see it. It tends to be pink and brown and red and all kinds of multicolors things. It just looks funny. You go in there and you can either have it, shaved off, frozen off, depending on the size of it, or a biopsy to remove it.
My question is it painful? Because say, for instance, you get something on your back or on the back of your neck. How do you know it's there if you really don't pay that much attention to your back,
Yeah, most cancers aren't painful. These skin cancers aren't painful unless for some reason it becomes an open wound. Like if it's on something you're rubbing and it's irritated. But that's why you need to have, if you don't have a loved one in your home to look at your moles on your back and stuff to see if it's changing, then you need to have an evaluation by your primary. They need to be able to look at your skin. You can look in a mirror, the bathroom mirror, to see if you have anything on your back and kind of keep an eye on it. But you either need to have a family member look at it to see if it's changing, or you need to go to your doctor and have them take a look at it, your moles.
All right, just don't be showing your back to everybody. Don't show your back to everybody.
Not to the strangers.
Yeah, they be like saying, well, I just need you to...
and start tripping right in front of them.
It would be like sitting up there like saying, oh, you wasn't supposed to see that.
Yeah. Be careful who you ask to check your moles out.
Yeah, they might stare too hard.
Yeah. So melanoma, which I'm sure people hear about, is the most dangerous of those three skin cancers. You can lose your life behind melanoma. And it comes in very strange places. I remember a pharmacist that I worked with, he actually had it in the back of his eye. He ended up dying. Yeah, how do you know that you even have it there? Comes in various places. It comes between your toes. It comes underneath your nail bed. I can give you an example of one person, a young person I know ended up dying. It was a white guy. He lived up in Northern California. He came down here, San Diego. He came to see me at Kaiser just as a same day. Don't know him, but he's a surfer dude, right? So he came down here visiting friends. He was surfing. He had something on his shoulder that was bleeding off and on, right? So I looked at it. It looked suspicious. We biopsied it to see what it was. Then I got some history because at the time, Northern California and Southern California, Kaiser Permanente didn't really, it's like two different entities. They didn't really talk, the computers, right? So I couldn't really get his information, but I called various places, called pathology up there in Northern California, Sacramento, found out earlier, like 5 years earlier, he had a spot somewhere, probably the same spot, that was biopsied that was suspicious, some suspicious cells. Well, of course, he didn't get anything done to it, that biopsy, but never followed up. He was a young guy, like 22. And then so he once again got another biopsy, which was now suspicious and had melanoma cells on it. By the time I could track him down, months and months later, it had spread all over. What I found out, it was already internal from the time he got the first biopsy to the next one. I don't know if it was a couple years later. It had spread to his liver and everywhere. He ended up dying. It was spreading all that time in his internal organs and everything. Melanoma. So we have to be very careful when you see a skin thing, a mole of some sort that's changing or bleeding on you. You have to go and have that. Something that's not healing or just looks suspicious. Go and have it checked out, have it biopsied, and make sure you follow up on the biopsy because that's what he didn't do. He didn't follow up on the first biopsy, and then he didn't follow up on the second biopsy in two different places. And so my investigation, because I couldn't let it go. I mean, I had to find this guy to tell him, hey, your biopsy is abnormal. You need to get this completely excised and then get a PET scan to see if it had spread into any internal organs. I finally found out his case, and he had it spread all over, and he ended up passing away.
Wow.
Yeah.
So one of the things about it is that it's really important for us, what you're saying, to do maybe monthly self-examinations?
Yeah, you can check on your moles and just keep an eye on them. But if you have a lot of moles, you should probably do an annual skin evaluation with your primary or your dermatologist, especially if you've had any basal cells or anything. Then you're now property of the dermatologist to keep an eye on your skin, because that's the one organ they deal with, right?
Okay.
And so they need to keep an eye on that and biopsy or freeze anything that looks concerning. There's all kinds of other things, what we call AK or SK, actinic keratoses. Those are scaly. I call them barnacles on your, like barnacles on a ship. They're scaly, rough and scaly, and they look like horns on your, they're, and that's from sun damage too. But those can be precancerous, but what we do is freeze those off because
Okay.
they catch on, your cold clothes catch them. But they're thick and scaly, look like just
Okay.
patches that somebody just put on there like a barnacle.
Okay.
And that's from sun damage. Tends to be more on white folks once again.
Okay.
But we freeze those off,
Okay.
right? So there's all kinds of skin changes. The goal is to protect your skin. Our babies that we have out there running around, put some sunscreen on them. Don't let them be exposed, because what we're seeing as in older white people is the damage from the 10-year-olds, the 12-year-olds. Over time, their skin, changes and causes problems, and they get the cancer. So we do need to be very conscious of that organ and protect it just the other way. Take good care of it like we would anywhere else.
Yeah. I'm smiling because I can see people now going to the bathroom and doing
Checking that.
self-examination and looking behind. Baby, come here. I feel something. Do you feel this thing? Because again, we see things that appear on our body, and if it doesn't hurt, and if it doesn't get any bigger, we think, oh, it's okay, and it could be going deeper versus bigger.
Yeah. So at least have it evaluated. When you're going into the doctor to ask for something else, just, put a note to yourself, ask about these 2 moles on my back, and let them take a look at it. A lot of times they're sebaceous cysts. There's so many different things on the skin. You just need to have someone with experienced eyes look at it, touch it, and reassure you, and then follow up on it. Document it on your chart, sebaceous cyst here, actinic keratosis, seborrheic keratosis here and there. Seborrheic keratosis is crazy, and some people have it, and it's like big brown scaly patches all over, like all over your abdomen, all over your back. And I had this one Hispanic guy. He just kept coming in, an older guy. I'd have to spray him. I'd have to fill the canister of liquid nitrogen, just spray I'll do about 2 dozen today, okay? Bzz, bzz. And it hurts because, you're destroying the top layer of the skin, and it turns red, and then over the next several days, it scales up, drops off, and that sort of thing. So it's uncomfortable. But he would come in and get his fix of getting a bunch of his AKs frozen off, and eventually he'd get a back that looked fairly normal because all those big old brown patches got taken off his back. So there's so many different things on your skin. You just need to be aware of the ones that are dangerous and the ones that are benign that you can either live with or just take them off if they're bothering you and they're cosmetic.
Okay. Any other things that we're going to talk about the skin? Because I want to ask the question, are we poisoning our skin with all these different products and makeups and everything else of that nature? Are we doing more damage than good to our skin?
Well, there's so many things on the market. I wouldn't even know what's out there that could be poison. You just want to make sure whatever you put on there you can wipe off later, right? So if you put your makeup on, make sure you have something to wipe off and then moisturize, right? But I'm not sure. If you take collagen and vitamin C and some other things to help with the elasticity of your skin over time, that helps, so that as we grow older and or if we lose weight and your skin starts sagging, the collagen can help with that. So you just want to read more about your skin and take good care of it like you would any other part of your body.
Because everybody talks about moisturizing and hydrate and everything. But as an African American, I have fairly oily skin, and I drank my water and everything else of that nature. How do you stop the oil from rising, or can you?
No, if you have oily skin, you have oil. Mostly in your face, you're talking though,
Yes.
right? Yeah. You just have, and especially the T-zone as we call it.
The shine.
Yeah, the shine. So you just have to wipe. You don't need to moisturize as much unless you use something like when you're washing your face. If you use something that's drying. If you use soap versus some other type of thing, or use an astringent, which is going to dry out your skin, you may want to put a little bit of moisturizer or give yourself 5 minutes so you can start rehydrating. Your sweat glands and your sebaceous glands, which produces wax on your skin to keep it smooth, is maybe just a little bit overactive,
Oh, because I'll tell you, I have 2 people in my family that have beautiful skin, and I said, what you put on your skin? They said nothing. But hot water. I wash off with a hot washcloth every morning, and that's all I do, and everything. So I'm just trying to figure out, how do you get that, that doctor Dr. Afflalo skin. Because I'm not from the islands.
Yeah.
And I don't have the mangoes and all that. And then I have to ask this question because all this is I'm seeing on social media. What's the thing with rubbing banana peels on your face?
I've never heard of that. Can
Okay,
you
I've been seeing
explain
that
to me?
lately.
Yeah, you stay on social media too much.
Well, no, it's not that. See, when we do shows and
Yeah.
everything like that, we see a lot of the
Commercials
feeds that
coming
come
up.
up and
Oh.
everything like that. And then the more you're on it on this, the more
More you
stuff
see it.
comes up. You know what I'm saying?
Ah.
And you were like, So I see a lot of things, and I see consistency of things, and I started laughing because I always look at everything on social media as an advertisement. So there's one guy who who puts his face in ice water, right? He always uses a certain bottle of water. And I'm like, and I want to say to everybody, he done filled it up with tap water, just poured it in out of that bottle. Because spending that much money just to stick your face in it, come on now, don't play me like that. But I believe that he's just advertising the water, and that's why he does it.
And getting some kickback from that.
Exactly.
Yeah, I don't know. There's, you never know what the reason for people doing things. I've never heard of rubbing banana peel or whatever on your skin, so I couldn't even say yay or nay on that one.
Okay, so and this is the reason why I think it's so important about Ask Dr. Follow and things of that nature, because so many hacks that are out there. There's so much false advertisement. We see so much that we wonder what's true, what's not true, what's reality, what's not reality. Everybody was talking. This is my last one. Everybody was talking about this mushroom coffee craze, and everybody's getting the mushroom coffee and everything, and they were like, Dr. T, you'll never know the difference between coffee and the mushroom. It's delicious. So somebody gave me that mushroom coffee, and I want you to know that dirt coffee that they gave me was horrible. I don't care what nobody say. It can keep you regular and everything else of that nature. Get some prune juice, something else. But that dirt coffee, and it was expensive as all no get out. And so, I just think that, Doctor, that we could come up with some clay. And we go down the street, get some clay, put it in a jar, and we can talk about moisturizing your skin with red clay. You know what I'm saying? And we might make a killing off of it.
We just might. I mean, people are being creative and coming up with all kinds of things. I think if we stick to basic, we'll be good. Yeah.
So in basic skincare, just give us some, maybe a couple of points on our basic skincare and our do's and our don'ts and what we need to look out for.
I would just say for skincare in general, you have to hydrate from internally, right? So I always talk about water, drinking a lot of water. And people ask me, why does my skin like that? Because all I do is drink water and lots of it. Then you do need to clean out the pores. So whether you mask from time to time to clean out your pores, or just use a nice soap, or use whatever line of product, Mary Kay or whatever somebody is. But, be careful with the astringents, which are the ones that like dry out your skin, because you do need to put a moisturizer. And I don't really care what kind of moisturizer you use, as long as it makes, when your skin feels dry. I know when my skin is dry. Then you just put a little bit of moisture back in there. You can also do it with collagen and vitamin C and some other things too.
Well, I'm gonna ask Dr. Follow, because I believe in manscaping, and I do like a mask once a month, avocado mask. And when I take the mask off, my skin feels so soft. So my question is, how do you know when you get your pores really clean?
Well, I think the reason why you feel that your skin is softer is because it's taken off the dead skin that's there,
Okay.
right? So if you don't kind of take that layer off that's been damaged and get to that other softer layer, then you don't know. But the pores, you do need to do something to extract some of the things from the pores. So a mask is a good thing. Some people don't do that, and that's fine. But, they may feel like their skin is dry, and you do need to exfoliate that dead skin. And that's where the mask comes in and kind of pulls off the old dead skin. Like how that snake just walks right out of, slithers out of his skin and gets new skin. You do need to do that. So, but then covering it, protecting it. So either cover with a UV T-shirt for avoiding damage to your skin. Also, wide brim hats if you're going to be outdoors for a long period of time at events like games that you're going to be out. Do that, or at least put some sunscreen on to prevent any further damage, because you won't get damage right then and there, but over time. And then if you're there long enough, you can get a sunburn. So you can also, you may not see the redness, but you'll feel like your skin is tender and sore. That's your sunburn.
Okay.
You've been out there, you might have a little bit of a tan, but you also got burned because now it's sore.
Yeah.
Right?
Yeah, I see that all the time. After I do a show or something like that, somebody said, "Oh, you darker today." I'm like, "Okay, praise the Lord." Trying to get my Idris Elba on.
And the melanin does protect us to some degree. We're not going to have nearly as much sun damage from our skin than the Caucasian population.
Well, we've been talking skin, and I say nothing but skin. We've talked about skin cancer. We've talked about psoriasis. We've talked about eczema. We talked about softening the skin, hydrating the skin, and also being aware of different things from moles to tags to other things that you have to be very cognizant of. And so really, more than anything else, it's about being in tune with your body, mind, and spirit. Well, Doc, before we go, can we do a quick advertisement?
Absolutely.
2 advertisements. One for the primary care, and then 2 for the wonderful events you do every month at the Jackie Robinson YMCA.
Okay. Well, I'll start off with IWC Primary Care, because that is the home of myself and all my colleagues, MP Danielle, all our new MPs that are in there, including MP Monica, who's been around for a while, and of course Mr. Grady, who runs the show over there in our clinic, our manager, our office manager. It's a wonderful place to visit. Everyone that comes there loves it, the ambiance, it's something they feel in the air. But we're really about taking the time that we need to take care of the patient, the individual patient. They're not a number there. We take whatever time we need. We focus on the whole body, not just the one problem that they come in with. So I love it there. The patients seem to love it. We're growing leaps and bounds. We're outgrowing our space, which is a good problem to have. So come on down and check us out at IWC Primary Care in Spring Valley.
Amen. I like it, and I also love how your name is on your scrubs and everything. I was going to try to figure out how I can get my name like that. I'm like, say, go on, Dr. Afflalo. And let's talk about this wonderful event.
And so the health fair we put on every first Wednesday of the month, February through December. I take January off. It's obviously about free services to our community, just trying to reach the people that are either underserved, they're marginalized, underrepresented, don't have health insurance. We take anybody and everybody. We don't ask any questions. Everyone's welcome to come. You can get free screening, so blood pressure, diabetes, cholesterol screening is done there, breast exams, and we should be bringing the UCSD's mobile mammogram van next month in September. There's a hopes, keep our fingers crossed. Okay. But we'll be signing up appointments for the mammogram. We're going to be signing them up next August event on August 6th so that we can do mammograms on September. Pet services, all kinds of vendors there providing resources. Food distribution is a big one because, things are very costly, so we have enough to feed 400 families.
Oh, wow.
And as we grow, we'll continue to request more. So it's a great place to be, good ambiance, DJs there helping to set the tone, and people have come to rely on us because we've been consistently out there for 8 years. We're there to serve.
Wonderful, wonderful, wonderful. Well, ladies and gentlemen, you've heard it here from Ask Dr. Afflalo. We come on every 4th Thursday of the month. Stay tuned next month. We will be right back here, same time, same channel. This is GODRadio1.com. Y'all have a very, very blessed evening.